Good afternoon. It's Friday, April 17th. It's right after lunch. I'm standing in Cathedral Square, as many of you Mobilians will recognize the background. Gorgeous day. I just want to recap the week and tell you the things we think that we've accomplished. But I'll just start off by saying I think at the end of the week we're a whole lot better off, a lot stronger, a lot more ready than we were at the beginning of the week. So if you focus first on the nursing homes, we found out that we had a much larger challenge at the nursing homes than we originally thought. So upon realizing this, there was a lot of outreach from the community to find out what could we do to help those operators to protect those citizens. Specifically in the city, we engaged with them to find out what kind of protective equipment the employees and their residents needed to have. We delivered a lot of that. So hopefully this week, going into next week, they'll be a lot better prepared. I want to think about what's happening with our healthcare providers. If you start off Sunday night with Lighted Up Mobile, it's certainly a great way to start it off. And then it was about delivering testing kits and delivering the test. A tremendous amount of tests have been done at Ladd Stadium this week and at the Diagnostic medical clinics. We've had more results, but we also know that really the virus is not going away yet. And we've said that it ought to be peaking right about now or going into the weekend or by Monday. And so we're real anxious to see if that's actually happening. But the system that has been developed at Ladd runs flawlessly. At the Diagnostic medical clinics, both of them, it's flawless there also. So we're really, really grateful for all the volunteers that are working there. Grateful to Synergy Labs for providing the test kits, as well as providing the analysis of those kits. And we continue to do the antibody testing, which is being done by the medical providers as a screening mechanism for what's happening. So those are some of the good things on the COVID front that have happened. But right here, you can't quite see it from this shot, but it's an amazing amount of asphalt that has been put down around downtown, taking advantage of there being almost no traffic. Had we had to wait to do this, or had we not taken advantage of the lull in traffic, it's really hard to project how long it would have taken us and how much additional money it would have cost us. Really proud of our engineering group and the contractors for jumping in here to make that happen. Over the last 4 weeks, there have been so many first things that none of us thought we could do. So I know that you've never even thought about a virtual art walk. But if you go to Mobile's Facebook page tonight at 6 o'clock, that's what we'll have. We'll have music. We'll have opportunity to shop. And so we're hoping that you'll participate in Art Walk, because there's been a lot of thought given into how to do this. And again, this is just a reflection on everybody realizing that we have to be creative and we have to do things differently. So please support Art Walk tonight. And by next month, we're hoping that all of this is behind us and we'll be able to, again, walk the streets of downtown, enjoying the art walks as we know them in the past. One other thing that everybody's probably heard about on the news by now, when we recognized the benefit of testing all of our first responders in the city of Mobile, and we realized that we could get more testing kits, there was a huge outreach from the smaller municipalities in Mobile County as well as Baldwin County. And so we're working with all of those first responders to try to help them get their testing of their first responders again. And all of that's in an effort to protect the citizens in both the counties. So great strides have been made there, but even greater strides will be made next week. So in closing, knowing that the peak is right here before us, please don't let your guard down. Please keep up the social distancing, stay at home, wash your hands, good hygiene, because we're going to get through the peak of this next week, and hopefully we'll be in great shape and all of you will be healthy.